Hey. So my name is Alessio Di Fonzo. I'm a neurologist. I'm based in Milan. I work in a polyclinical hospital in Milan. And it's about 10 years that I'm working in collaboration with a rare disease center in Milan, visiting patients with rare diseases, especially from the neurological side, symptoms and treatments, and especially Gaucher disease patients. So in the past few years, I've been visiting almost the majority of patients with Gaucher disease in Italy in order to find signs and symptoms of Parkinson disease and also other neurological manifestations. Yeah, so as a neurologist, most of the patients that are referred to me and in general, they do not have a diagnosis, and in most of the cases these patients have rare diseases, a rare form of ataxia, dystonia. There are many types of neurological rare forms. So I think that these are mostly orphan forms. The mechanism is not known, the therapies are absent. So for this reason, I decide to invest more on understanding and following patients with these diseases. Since on one side I'm a neurologist, but my background is also in genetics, since my PhD was on medical genetics. So combining the knowledge on neurology and genetics, I try to understand and to help more these patients and what is happening, what is the mechanism, and what are the possible future therapies for all these rare forms. So Gaucher disease is caused by the biallelic mutations in the GBA1 gene, and the variants in the GBA1 gene are the most common risk factors, genetic risk factors for Parkinson disease. So, of course, people with the variants in this gene, mono or biallelic, have increased risk of Parkinson disease, but the risk of patients with Gaucher disease is was not that clear, because, of course, it's a rare disease, and collecting data for such rare disease, of course, is not easy. And so this was the rationale from the study that I'm presenting here, from a collaborative international team of really distinguished experts in Gaucher disease and Parkinson disease, and starting from data from more than 1,400 patients with Gaucher disease type 1 from the International Collaborative Registry, we asked patients to inform us about a diagnosis of Parkinson disease, and also about symptoms of signs suggesting the possibility of Parkinson disease, or maybe a prodromal phase of Parkinson disease. And then we analyzed these results, which were quite informative. So, interestingly, the findings were that subjects with Gaucher disease type 1 had an increased risk to develop Parkinson disease at 60 years compared to the general population. We know that in the general population the risk to develop Parkinson disease is 1%. One person is developing Parkinson disease. For Gaucher disease type 1, we found that between 2 and 3% of the subjects develop Parkinson disease. So the risk was increased, but on the other hand, this risk is not that high, and the majority of patients with Gaucher disease were not developing Parkinson's disease. And I think that this was explored also at 70 years, at 80 years. We did some analysis on the type of genotype correlating the risk to the genotypes. But the point is that the risk was increased, but not that much. I think that the implication for patient is quite, let's say, important, so we can counsel patients and say that the majority of patients will not develop the disease. We can follow patients with prodromal symptoms, but the study so far showed that at 80 years, up to 88% of patients will not develop Parkinson's disease. So it's just an increased risk, but let's say it's quite good news for patients. On the other hand, I think that this result has a very important implication in the understanding of the link of GBA1 variants and Parkinson's disease, since we noticed that the risk of subject with one variant in the gene and subject like the Gaucher disease patient with biallelic variants in the genes have a similar risk. So this is suggesting that probably the mechanism linked to the GBA1 variants to the risk of Parkinson's disease is different than the mechanism related to the Gaucher disease. Otherwise, we would expect a very higher risk of patients with Gaucher disease to develop Parkinson's disease. I think that the implication is, on one side, the implication in genetic counseling of patients. This is changing because we have some more information from a very large, let's say, cohort, which is really important in terms of how we believe, how is strong the information that we are counsel to patients about the risk of PD on one side. And on the other side, I think that this should prompt the scientists to look more to other mechanisms linked to the GBA1 gene in the, let's say, increasing risk of PD. What are the other mechanisms? Not only the impact on the enzyme activity, which is very low in patients with Gaucher disease, but is not enough to increase the risk respect to those that have only one GBA variant. I think that rare diseases are really a very good opportunity to understand the mechanism also of frequent diseases such as Parkinson's disease on one side, on the other side to study the mechanism and to observe symptom signs, to do epidemiological studies in rare disease. We need collaborative studies. It's the only way to get robust results, and I think that this was really demonstrating how collaborative studies are necessary to understand the mechanism of these diseases.